Welcome to the Ottawa Hospital. Treating pain is an important part of the recovery process after your upcoming surgery. One of the options for pain control involves the use of specialized nerve blocks. This video will explain what to expect if you have a nerve block for the arm or shoulder. An upper limb block is used to provide pain relief during and after surgery. Local anesthetic, or freezing medication, is injected into your neck, shoulder area, or upper arm, depending on the type of surgery that you are having. This numbs the area where surgery will be performed. This procedure is used for a variety of surgeries on the shoulder and arm. The nerve block may be followed by a general anesthetic, which puts you to sleep for the surgery. These blocks can also be combined with sedation, using medication for relaxation throughout the surgery. About an hour before surgery, you will be taken to a special area where the procedure is performed. Here you will meet the team of anesthesiologists and their assistants. They will explain the procedure and answer any questions you may have about the block. The decision to proceed with an upper limb nerve block will be made at this time. Standard monitors such as a blood pressure cuff, heart rate, and oxygen monitors are used. An intravenous will be started, which will allow the anesthesiologist to give you medications if you need them. You will be lying on your back. Your neck and shoulder will be uncovered and wiped with an antiseptic solution to reduce the chance of infection. The anesthesiologist will identify and mark the correct area. A small needle will be used to freeze the skin. A single dose of medication is injected in the area around the nerves. For some surgeries, a small tube called a catheter is left in place to provide pain relief over the next few days. The procedure takes about 15 to 20 minutes, and then you will be taken to the operating room for your surgery. You may receive some medication to help you relax. Most people tolerate the procedure very well. You may feel a pinch or burning sensation when the freezing medication is injected. You may feel discomfort, pins and needles, or muscle twitching while locating the correct space. If this happens, try to remain still and tell your anesthesiologist exactly what you are feeling. It usually takes more than 20 minutes for the freezing to take full effect. Your skin may feel warm at first, and then your arm will feel numb and weak. The upper limb block is an excellent method of providing pain relief both during and after surgery. It is relatively easy to do and freezes only the area where surgery is performed. Your pain should be significantly decreased immediately after surgery. This means that you are likely to require less pain medication, which lowers the risk of side effects like sedation, confusion, nausea, vomiting, constipation, and itchiness. Upper limb blocks have also been shown to lower the risk of developing chronic pain after surgery. People vary in how they interpret words and numbers. The following scale will give you an idea of the risks involved with this procedure. For example, a risk is considered very common if it happens to 1 in 10 people, or for example, to someone in your family. On the other hand, a risk is considered very rare if it happens to 1 in 100,000 people, or for example, someone in a city. For most people, breathing muscles on the same side of the block are temporarily weakened. Most patients do not even notice this change. You may notice temporary changes on one side of your face, including a change in pupil size, a droopy eyelid, and decreased sweating. This does not represent a stroke and goes away as the freezing wears off. Uncommon complications include lung puncture, prolonged weakness of the breathing muscles, and infection. Rare complications include freezing medication injected too close to the spinal cord, permanent nerve damage, significant bleeding, or freezing medication overdose resulting in seizure or very rarely death. It is normal for the arm to be numb and very weak while the freezing medication is working. You will be given a sling to support your arm. You should be very careful during this time, as it is possible to injure your arm without knowing it. Please tell your surgeon if any numbness or weakness continues several days after the nerve block is performed. A single dose of freezing medication lasts for 12 to 24 hours. Be sure to fill the prescription ordered by your surgeon. As the freezing medication wears off, you will slowly become more aware of pain. It will be important to start taking pain medication pills as soon as this happens before the block has worn off completely. If the freezing medication is still working during the evening, we often recommend taking a dose of pain medication before you go to sleep. If you have a catheter, you may go home with a small portable pump which provides continuous freezing medication. This catheter usually stays in place for a couple days and then is easily removed by you at home. Once the catheter is removed, there is no further care required. You will receive detailed instructions about your pump and caring for your catheter before you go home. You will also receive a telephone number for any issues or concerns, and you will have access to a pain service physician 24 hours a day. If you stay in hospital after your surgery, a member of the pain service will see you each day that you have the catheter to make sure that your pain is well controlled. Please feel free to watch this video again and to ask any questions you have during your appointment in the preoperative assessment unit. Thank you for watching.